Good morning. Thank you for coming here today and joining us. I'm New York State Attorney General Schneiderman. Pleased to be here with our colleagues from the MTA and others to make an announcement. We are joined here by the Vice Chairman of the MTA, a longtime champion on issues related to keeping our people safe and our children safe and dealing with the problems of drug abuse, the former Bronx Borough President Freddie Ferrer, a great colleague of mine. Also joined by Chief Michael Cohn of the MTA Police Department, which is the 7th largest law enforcement agency in the state of New York and has vast scope and reach. We're very pleased that the Chief could join us here today. And finally, Susan Salamone, who lost her son, Justin, to a heroin overdose at the age of 29, and who co-founded the educational and support group Drug Crisis in Our Backyard. And she is one of the heroes who have taken a personal tragedy and instead of retreating, come forward to do public education and try and help us prevent other such tragedies from happening to other people's children and parents. We are here to announce today that the MTA is joining my office's new Community Overdose Prevention program, or the COP program, and we will be equipping MTA police officers with an amazing drug called Naloxone that saves lives in the case of a heroin or opioid overdose. Our COP program was created once Naloxone was perfected as a vehicle for law enforcement to use. It used to only be applied intravenously. It could only be administered intravenously, and then they developed a nasal spray so that every police officer can administer it safely. There are no contraindications for this drug, and what it does is prevent death from overdose. We're announcing today that we're provided $40,000, actually a little in excess of $40,000, which will pay for 670 kits with Naloxone and the inhaler equipment for the MTA police force. This police force goes into 14 counties, Long Island Railroad, Metro North. We're here at Penn Station, which is really the transportation hub that goes out to Long Island. We're very close to Grand Central Station, the transportation hub that goes up the Hudson River. And it's very important to understand what a problem opiate and heroin abuse has become in the suburban regions served by the MTA. This is not just a problem in inner cities anymore. This is a problem statewide and nationwide. We have now, since we set up the COP program, we've paid for about 2,400 Naloxone kits for 59 different police departments. The demand has been extraordinary, and a short time ago, I think the total of police departments now coming in to ask for the kits that we're working to equip are 107 law enforcement agencies. We committed a total of $5 million to pay for Naloxone for any police department that wants it, and if we have to dedicate more funds, we are prepared to do so. The forfeiture funds we're using here actually comes from joint federal-state investigations of drug gangs. The forfeiture funds come from investigations we conduct jointly with our federal counterparts, and it's appropriate that we are using them for this purpose. Again, northern Manhattan, the Bronx, parts of Westchester County are the national hub for the importation and distribution of heroin in the Northeast. Staten Island, Manhattan, Westchester, and Rockland counties are among the top 10 counties in New York State for the number of opioid-related hospitalizations per 1,000 people. And in New York City, heroin-related overdose deaths increased 84% between 2010 and 2012 after 4 years of decline. We are facing a heroin epidemic in our state, and it's important that we apply what we call in criminal justice an all-levers approach. We have done that in New York. We have reformed our drug laws. We have brought our prison population down while bringing crime down. We've made more treatment available. We have made, we've created the iStop system that has cut doctor shopping by 75% in its first 8 months of operation to stop the flow of prescription drugs. We now are seeing the growing problem that has been growing in parallel with the prescription drug abuse problem of heroin coming back. It's stronger, it's cheaper, and as we were discussing earlier, from my point of view, this epidemic, which is destroying lives and destroying our communities, seems to be spreading more quickly than I would have thought it should, because the stigma attached to heroin appears to have been lost. Young people today don't seem to be concerned about the addictive qualities of opioids the way we were a generation or two ago. And that's why raising public awareness about this is a very important part of our work as we work with our colleagues in law enforcement. To take down drug gangs, last week we announced the result of an investigation, 32 arrests, $1 million worth of heroin and hundreds of thousands of dollars worth of cocaine in Western New York. We have to stop the flow. We have to prevent overprescribing through iStop. We have to provide treatment, and we have to provide naloxone. In a pilot project in Suffolk County, they saved 170 lives. The naloxone, use of naloxone was 95% effective.
Mario, Omenville, Bayside, Douglas, Little Neck, Great Neck, Manhasset, and Port Washington, track 20.
95% effective in Suffolk County, and we know it works, and we know it saves lives. And as soon as you save someone's life in naloxone, they wake up and they're in withdrawal, and you can immediately get them into treatment. The point of this is not just that you save someone's life and they go walking away. You've then identified a serious drug problem. In most cases, the person, whatever efforts they had to deny it, that falls away, and we have a great opportunity to get people in treatment and out of this cycle. I thank you for being here, and now I'd like to introduce a great colleague in the fight for safe streets, safe cities, the fight to keep our kids drug-free, MTA Vice Chairman Freddie Ferrer.
Thank you, Attorney General Schneiderman. On behalf of the entire MTA family, our Chairman and CEO, Tom Prendergast, I want to commend you for this important and imaginative initiative. There's no small irony in taking the funds collected from seizures and using them to save lives. And in this case, over our multi-county and multi-state region, that's an important thing. In the hands of our very capable MTA Police Department, led by Chief Michael Cohn and Director of Security Ray Diaz, this is an important life-saving tool. We were just in a room where babies have been delivered, heart attack and stroke victims have been cared for, and in some cases brought back to life. There's no doubt in my mind that this drug is another important tool in our toolbox to make our passengers, and indeed anyone who passes through these doors, safer. Now,
attention Mets and Yankee fans, avoid traffic, tie-ups, and parking fees. Take the Long Island Railroad to Mets Willis Point for the Mets-Yankees Subway Series on May 14 and 15. Trains from Woodside and Old Port Washington branch stations will stop at Mets Willis Point for the series.
did you all get that?
Long Island Railroad branches must transfer at Woodside to Port Washington branch trains to City Field. See www.mta.info for schedules and details.
We believe in more information, not less. Let me again thank you, Attorney General Schneiderman. This is important. Anybody who thought that heroin use was a thing of the past or localized to certain neighborhoods had better think again. It's back. It's particularly virulent, and it's not located in certain neighborhoods of New York anymore. It's everywhere. And in order to keep our kids and our families safe, this important tool is coming just in the nick of time, and we thank you, Attorney General Schneiderman.
Thank you. Thank you. And now I'd like to introduce MTA Police Chief Mike Cohn. Chief.
Thank you. I'm extremely pleased to be here today and to receive the grant from the COP program. The MTA Police Department is extremely grateful to Attorney General Eric Schneiderman. The MTA Police Department is responsible for the safety and security of the Long Island Railroad, Metro North, Staten Island Rapid Transit System, covering over 5,000 square miles. In this capacity, we respond to thousands of calls of service for service each year, including over 4,700. Over 4,700 aided cases each year. This initiative will greatly enhance our first responder and first aid ability. Currently, MTA police officers are trained in the use of the AED, it's the automated external defibrillator, CPR, and treating diabetic emergencies. This grant will allow the MTA Police Department to arm our officers with Naloxone kits. We will begin training immediately and expect to have over 600 officers trained by the fall. Once again, I want to thank the Attorney General. Thank you.
Thank you, Chief. Thank you. Thank you. And finally, someone who is really important to this effort. There is no way we would have gotten a lot of the reforms enacted into law, including iStop, we did without the help of people who had lost loved ones to drug abuse and who, instead of retreating into their own space and taking care of themselves, have rededicated themselves to this cause of making sure no one else's children have to suffer and no other families have to suffer. And it's a great pleasure to introduce to you now Susan Salomon.
Thank you. Thank you, Attorney General Schneiderman. I really appreciate the opportunity to be here, and thank you for calling me in. I'd like to thank you for understanding the enormity of this problem. I live in Putnam County, and young adults are dying every week, once a month. Parents are crying. My son, Justin, passed away 2 years ago, May 29th, 2012, of a heroin overdose. And the police force came first in just a few minutes after we called 911. But they didn't have any Narcan on them. And the EMS didn't show up for about 15 minutes. And they did have the Narcan. After my son died, we started an organization called Drug Crisis in Our Backyard with another couple. And we've been in place since about June 2012. And we've met so many parents who've lost their children and so many parents that are suffering with this disease. We've done 3 Narcan trainings with Vocal New York up in Westchester and Putnam County. We've trained about 150 people. And one of the parents that I know saved her son using the Narcan kit she got at our training. So I really appreciate that you're coming out, Attorney General, and letting the world know that this is an epidemic. This is not isolated to any one area. It's actually an epidemic we have in our country. So we need everyone to come forward and talk about it so that we can erase the stigma attached to the people that are suffering from this disease. Thank you again for having me here.
Thanks, Mike. And now Andrew will direct questions.
Just introduce yourself before you start the question.
Martinez from New York One. Is there any particular connection to the transit system and drug use, say from people who are in the station or who rely on the system?
Well, I think my colleagues can speak to that, but the MTA system is where this is how everyone travels around to purchase drug users, and we don't want to have a situation in which people are in transit. If you're on a train or a subway or on any other part of the MTA system, there is no health care available. There are no EMTs. The only hope you have is that the MTA police would have Naloxone or the brand name Narcan that Susan mentioned. So it is an essential part of, and this is just a vast police force. People don't get how important this is in law enforcement in our whole state. It's, again, the 7th largest police department in the state. Chief, do you want to speak to that? Sure.
We expect to receive the kits almost immediately. We have officers that are in place now to get training on the use of it, and then those officers will in turn train. As I said, over 600 officers will be prepared by the fall, but a small amount of those they'll be ready within 48 hours of receiving the kits. It's a 30-minute training. Once the officers are trained to train the trainer, it's a 30-minute training for each subsequent officer and we'll be able to roll it out quite expeditiously. Yes.
T.Y., go ahead.
I mean, there's no question that the more first aid ability my officers have in their hands, that we can save lives. We've saved people with the AED. We've done that in the past, and we continue to do it in the past. I foresee, with the amount of volume of people not only that take our trains, but that come through our stations and terminals and the surrounding areas that we police, many times we're the first responders to those areas, whether or not they're on the trains or in the right-of-way or not. I certainly believe that this kit will save lives. Out of the thousands of aided cases, we have had a handful of overdoses, and quite possibly we could have saved lives.
Let's do the on-topic stuff first, and then we'll...
11:34 parcels, regarding the situation at the Heroin Park, many of the complex bus cars.
No, I think it's about $60 per kit, and but police departments don't have any excess cash. They've had cutbacks in recent years, so we thought it was an appropriate use of drug forfeiture funds. And now there's no obstacle to every police officer in the state of New York having naloxone. And if anything, I think that the volume of the use now, the price is probably going to come down. No, absolutely not. What this does is save lives. There is absolutely no evidence that this in any way, shape, or form in any of the pilot programs around the country encourages drug use. This saves lives and gets people into treatment. Yes, as I mentioned, we have had requests from 107 law enforcement agencies around the state since we kicked off this program a very short time ago. And we look forward to continuing to work with our colleagues in government. The way it works is the police department has to make a determination that they're going to add these kits and do the training. We then provide the funds for the kits, and it's rolling out very quickly all across the state. No, this is for the whole MTA, buses, subways, everywhere. The police force covers everything. The drug is incredibly fast acting. We have the records from the Suffolk County program, and it takes effect within a matter of a couple of minutes. And so if you get to someone, and it varies depending on the circumstances, but 20, 30, 40 minutes. They say 30 to 90, but you want to get there as early as you can. But certainly there is a window where our experience is that if you get to someone 30, 40 minutes out, you can save their life easily, and maybe as much as 90.
Go, Ross. You want to ask your question?
Sure. I just want to ask what you made of prominent Democrats, Mark Magruder and Gil, who were coming to your defense yesterday and attacking your opponent. Also, your opponent attacked you for kind of using the Attorney General's post as a way to become governor someday. How did you react to it?
We're here trying to save people's lives and deal with the drug problem. I don't really have any comments on that. I'm not here to talk about that right now, and I'm really not focused on it. Thank you. Espero que sí.